Bipolar disorder is a mental health condition. It causes extreme shifts in mood. Imagine a swing that goes very high and very low. That's what moods can feel like with bipolar disorder. These mood swings can last for days, weeks, or even longer. People with bipolar disorder experience periods of intense highs and lows. These highs are called manic episodes. The lows are called depressive episodes. These episodes can be very disruptive to daily life. Bipolar disorder is a serious condition, but with proper treatment and support, people with bipolar disorder can live full and meaningful lives. There are different types of bipolar disorder, each with its own unique set of symptoms and characteristics that affect individuals in various ways. Understanding these differences is crucial for both patients and healthcare providers to ensure proper diagnosis and treatment. The main types of bipolar disorder are bipolar 1, bipolar 2, and cyclothymic disorder, each presenting distinct patterns of mood swings and episodes. Bipolar 1 disorder is characterized by at least one manic episode, which is a period of abnormally elevated mood and high energy, often accompanied by erratic behavior. This manic episode may be preceded or followed by a depressive episode, where the individual experiences intense feelings of sadness, hopelessness, and a lack of energy. Bipolar 2 disorder, on the other hand, involves a pattern of hypomanic episodes, which are less severe than manic episodes, and at least one major depressive episode. Hypomanic episodes in bipolar 2 disorder are characterized by elevated mood and increased activity or energy levels, but they are not as extreme as manic episodes. Cyclothymic disorder is considered a milder form of bipolar disorder. It involves periods of hypomania and mild depression that are less severe than those seen in bipolar 1 and 2 disorders. These periods of mood swings in cyclothymic disorder last for at least 2 years, with symptoms present more days than not, but they are not as intense as the full-blown episodes of bipolar 1 or 2. Understanding the different types of bipolar disorder is essential for accurate diagnosis, as each type requires a tailored approach to treatment. It also helps determine the most effective treatment plan, which may include medication, therapy, lifestyle changes, and support from healthcare professionals and loved ones. Support groups and therapy sessions can provide a sense of community and understanding, helping individuals manage their condition more effectively. With the right treatment and support, individuals with bipolar disorder can lead fulfilling and productive lives. It's important to remember that while bipolar disorder is a lifelong condition, it is manageable with the right strategies and interventions. By understanding the nuances of each type of bipolar disorder, we can better support those affected and help them achieve a better quality of life. Bipolar disorder affects people in different ways. It is a complex mental health condition that can significantly impact a person's life. Understanding the symptoms is crucial for recognizing and managing the disorder effectively. However, there are some common symptoms that many individuals with bipolar disorder experience. These symptoms can be broadly categorized into manic and depressive episodes. During a manic episode, a person might feel extremely happy, euphoric, or unusually irritable. This heightened mood can last for days or even weeks. They might have racing thoughts, making it difficult to focus on one thing at a time. Sleep becomes elusive, with the person often feeling restless and unable to settle down. During these manic phases, individuals might also engage in risky behaviors, such as going on spending sprees, driving recklessly, or making impulsive decisions without considering the consequences. Conversely, during a depressive episode, the person might feel overwhelmingly sad, hopeless, or worthless. These feelings can be intense and persistent, making it hard to see any positivity in life. They might lose interest in activities they once enjoyed, finding no pleasure in hobbies or pastimes that used to bring them joy. These extreme shifts in mood can make it hard to function in everyday life. Simple tasks can become overwhelming, and the person might struggle to get out of bed or complete daily responsibilities. Relationships, school, and work can all be affected. The instability in mood can lead to conflicts with loved ones, difficulties in academic performance, and challenges in maintaining a job. It's important to remember that these symptoms are not the person's fault. They are dealing with a medical condition that requires understanding and support from those around them. Bipolar disorder is caused by a combination of genetic, biological, and environmental factors. Treatment often involves a combination of medication, therapy, and lifestyle changes to help manage the symptoms and improve quality of life. Diagnosing bipolar disorder can be challenging. There is no single test. Doctors use a variety of methods to make a diagnosis. They will likely conduct a physical exam and order blood tests. They will also ask about medical history and family history of mental illness. And a mental health professional will conduct a psychological evaluation. This involves talking about thoughts, feelings, and behaviors. It's important to be honest and open with healthcare providers. This will help them make an accurate diagnosis. Early diagnosis and treatment are crucial for managing bipolar disorder effectively. Section 5. Navigating treatment. Finding what works. There are effective treatments for bipolar disorder. Treatment typically involves a combination of medication and therapy. Medications such as mood stabilizers can help regulate mood swings. Therapy can provide coping mechanisms and support. Cognitive behavioral therapy, or CBT, is a common type of therapy used for bipolar disorder. It helps identify and change negative thought patterns. Finding the right treatment plan may take time. It's important to work closely with healthcare providers. They can help determine the best course of action. Section 6. A friend's story, living with bipolar disorder. I have a friend named Sarah who has bipolar disorder. Sarah is one of the most resilient people I know. Her journey with bipolar disorder has been a challenging one, but also incredibly inspiring. She was diagnosed in her early 20s. It was a time when she was just beginning to explore her career and personal life. The diagnosis came as a shock to her and her family. At first, she was scared and confused. The symptoms were overwhelming, and she didn't know how to cope with the sudden mood swings and emotional turmoil. She didn't understand what was happening to her. The highs and lows of bipolar disorder made it difficult for her to maintain relationships and focus on her goals. With the support of her family and doctors, Sarah found a treatment plan that worked for her. Her family stood by her side, offering unconditional love and encouragement. She takes medication regularly and sees a therapist. The combination of medication and therapy has been crucial in helping her stabilize her mood and manage her symptoms. Sarah has learned to manage her condition. She practices mindfulness, journals her thoughts, and exercises regularly. These activities help her stay grounded and maintain a positive outlook on life. She is now a successful artist and advocate for mental health awareness. Her art is a reflection of her journey, and she uses it as a platform to raise awareness about bipolar disorder. Sarah's story is a reminder that people with bipolar disorder can live fulfilling lives. With the right support and treatment, they can achieve their dreams and make a positive impact on the world. Her journey shows that while bipolar disorder is a part of her life, it does not define her. She continues to inspire others with her strength, creativity, and advocacy. Section 7. You are not alone. Support systems and resources. If you or someone you know has bipolar disorder, it's important to remember that you are not alone. There are many resources available. Support groups can provide a safe and understanding environment. They offer a place to connect with others who understand the challenges of bipolar disorder. Online resources and educational materials can also be helpful. The National Mental Health Association and the Depression and Bipolar Support Alliance are great places to start. Remember, seeking help is a sign of strength, not weakness. Section 8. A brighter tomorrow, living well with bipolar disorder. Living with bipolar disorder can be challenging, but with the right treatment, support, and self-care, individuals can live full and meaningful lives. It's important to prioritize mental health. This includes getting enough sleep, eating a healthy diet, and exercising regularly. Stress management techniques such as meditation or yoga can also be beneficial. Remember, recovery is a journey, not a destination. There will be ups and downs along the way, but with perseverance and support, a brighter tomorrow is possible. Section 9. Stay informed, stay hopeful. Bipolar disorder is a complex condition, but with increased awareness and understanding, we can break down the stigma surrounding mental illness. Stay informed about mental health. Educate yourself and others. Support organizations that are dedicated to research and advocacy. Remember, there is always hope. With the right treatment and support, individuals with bipolar disorder can live fulfilling and meaningful lives. For more information and resources on bipolar disorder, subscribe to our newsletter and visit our website.